In today's video, we're going to learn all about hereditary breast cancer from TikTok videos.
How to get tested for BRCA. Option 1. Visit a genetic counselor. Ask them to do a full panel test. May or may not be covered by insurance. Option 2. Look up color.com. Get their hereditary cancer test. It's only $250.
So the first thing to clarify is what she means when she's talking about BRCA versus a full panel test. Until about 2013, it was common to only test for genes called BRCA1 and BRCA2, or the BRCA genes, which are genes that are related to hereditary breast cancer and ovarian cancer, as well as a few other cancers. Since then, it's increasingly common to order multi-gene panel testing. So these are panels that include not only BRCA1 and 2, but about 10 breast cancer related genes, and sometimes also genes related to other types of cancers. And it's true that genetic testing may or may not be covered by your insurance. There are specific medical criteria that are published by the National Comprehensive Cancer Network and are updated about 2 or 3 times a year. Over time, these criteria are getting looser, meaning that more and more people will qualify for genetic testing as time goes on. If you do meet criteria, then your insurance should cover the cost of the test. And if you don't meet criteria, depending on your insurance, as a genetic counselor, I would know which lab is best, where you'll get the best price. Because, for example, there are some insurances that even if you don't necessarily meet criteria, or even if you do, you will pay max out of pocket $50 or $100. So that's one important reason to see a genetic counselor, because we know how to work with your insurance, which is the best lab for you. So let's talk about what you get for $250 at Color. So you purchase a kit, and you see for $250 you have the hereditary cancer test, as well as their hereditary heart health test. So those are genes related to heart disease, and their medication response test, because there are certain genes that would predict how a person responds to certain types of medications. And all of those 3 tests are $250 plus the cost of shipping and handling. So let's talk about the good part first. Color on their hereditary cancer test has selected 30 genes that are related to the 8 types of cancers that are most commonly hereditary. And these include breast cancer, ovarian cancer, colon cancer, endometrial cancer, prostate cancer, stomach cancer, melanoma, and pancreatic cancer. What's nice is that they also work with many different countries, so you may live in Singapore and you can order genetic testing from Color and they will ship a kit to your home. And on their website you can see a list of all the countries that they're currently available in. So the list is really long, and over time I think they're adding more and more countries that they work with. So this is a really good option, for example, for somebody who has a lot of family in a different country and where genetic testing may not be easily available. Color is a great option for those people. Something else I really like about Color is their test reports. They are so easy to read, very patient-friendly, unlike the genetic test reports from some other labs. And by the way, if you've had genetic testing and you're confused about anything on your test report, check out this video here where I go through it step by step and explain how to understand your test report. The other thing that's really great about Color is that they offer complimentary genetic counseling. So if you pay to have genetic testing through them, you can then speak with a genetic counselor who can explain to you your test results. So that's really nice, and also not a service that is necessarily offered by all the other testing labs. Overall, I think Color is a great option for genetic testing, and we use them in clinic, but there is a really important limitation to be aware of. Depending on your own personal and family history of cancer, they may not be the perfect test for you, because they don't include all the genes that might be available at other labs. So, for example, if you have a family history of kidney cancer or certain endocrine tumors like thyroid, adrenal gland tumors, there's a lot of key genes that are missing. There's also a few genes that are related to colon polyps that are not included on the Color test, as well as an important gene related to prostate cancer risk and genes related to more rare hereditary cancer syndromes. So if you have a family history of any of these types of tumors, this would not be the right test for you. Also, every year, more and more genes are being discovered that are related to different types of cancers, and some of them don't have too much evidence yet on exactly how they are related to cancer risk. So we call those preliminary evidence genes. And a lot of these genes are available for testing through other labs, but Color doesn't offer those. So those preliminary evidence genes, if you tested positive, it may not change your medical management at this point, but it may provide an explanation for why there's cancer in the family, and hopefully in a few years from now, we would know more about what it means. So Color is a great lab, but their panel of cancer genes is a little bit limited compared to some other labs, so it may not be the best option for you. And by the way, there's a lot of other labs that now offer the same price of $250 where you have many more genes available for testing. So overall, my recommendation would be to meet with a genetic counselor who can take your personal and family history of cancer into account when deciding which is the best genetic test for you. Before we move on to the next TikTok video, I wanted to see which of these options you might be most interested in for a future video. So let me know in the comments below. All right, let's see what the next video is about.
Here's my part one. Have mammograms. All it takes is missing one for them to miss something significant like breast cancer. Have genetic testing done. I went from having a 30.6% chance of having breast cancer within the next 5 years to when I went to the doctor yesterday, I'm up to a 61.7% chance within the next 5 years. Me and my doctor decided, hey, because of my high risk and my family history, my mom has had breast cancer, my aunt has had breast cancer. It is a big deal, ladies. I'm going to have a double mastectomy. I'm going to have reconstructive surgery. I'm going to have implants. Whether or not that's going to be saline or silicone, I haven't decided yet. I meet with my plastic surgeon closer to the end of this month, and I have my surgery on the 9th of March. I'm 27 years old. It can happen to you. It can happen to anybody. Stay tuned for my part 2, and we'll go into more depth.
So this woman underwent genetic testing and tested positive for a genetic mutation that puts her at higher risk to develop breast cancer. And the National Comprehensive Cancer Network recommends considering preventative mastectomy if you have a mutation in one of 5 genes. And those are BRCA1, BRCA2, PALB2, PTEN, and TP53. Aside from those genes, there's a whole group of other genes which are associated with breast cancer, but for which the evidence is not high enough at this point to say that you should for sure have a preventative mastectomy, but that we should manage a person's risk based on their family history of cancer. So it is a surgery that can be considered if the family history of breast cancer is high enough. Now, in terms of the degree of protection that you get from a mastectomy, this has been well studied for many years, and it appears that overall your risk of breast cancer decreases by 90% or more if you've had a preventative mastectomy. And I'll link to some studies in the description box below. When it comes to reconstruction options, which she briefly mentioned in the video, there are different options. You can have immediate reconstruction or delayed reconstruction, so that would be either 1 surgery or 2. And nipple-sparing mastectomy has also been shown to be an option that is safe and effective, although more data is still needed. And of course, there's always the option of not having reconstruction and just leaving the chest flat. So there's really no wrong or right answer. It's a personal decision. I'm also going to link in the description below to FORCE. That's a support organization called Facing Our Risk of Cancer Empowered for people who have a hereditary predisposition to breast cancer. And they have an excellent page of information on mastectomy and reconstruction options. They even have a nice list of questions that you can print out to take to your appointment with your breast surgeon or your plastic surgeon. So I'll link to that below. It's an excellent resource. And if you're thinking of having this type of surgery, a preventative mastectomy, because of a high risk of breast cancer, the best thing is to be in the hands of a breast surgeon who's done this type of mastectomy many times before. So let's move on to the last video.
I am pretty sure that my mohawk is too long to stand up. I tried to put it up today and I'm floppy, but I'm also not exactly practiced in doing mohawks. So, you know, that could be part of it. I'll figure it out. I'm sitting in the genetic counseling room. It's super exciting and fun. About to get my blood drawn, hopefully, and find out what sort of genetic markers I have for predicting cancer and recurrence and all that fun stuff. So, won't have results for several weeks, but, you know, keep your fingers crossed that I don't have any genetic markers and that I can make some easier decisions because of that.
So for this video, I think it's useful to talk about what she means when she's talking about decisions. So if you have breast cancer and you have genetic testing, what are the types of decisions that might be influenced by your genetic test results? The first most immediate decision to make is what type of breast surgery you're going to be having for your current breast cancer. So that might be either lumpectomy, just removing the tumor within the breast, or just removing the one breast that has the cancer. But if your genetic testing comes back positive, for a genetic mutation that puts you at higher risk to develop another breast cancer in the future, especially if it's a mutation in one of those first 5 genes that I mentioned with the previous video. Your risk of developing another breast cancer in the future is much higher than people who don't have a mutation in these genes. So in that case, you may want to consider removing both breasts instead of just the one or just the tumor to really reduce your risk of another breast cancer as much as possible. So that's the most immediate decision. But then there's also future surgical decisions, because a lot of these breast cancer related genes are also associated with a higher risk of ovarian cancer. And because we don't have very good screening for ovarian cancer, there's not really a reliable way to detect ovarian cancer early. If you're found to have a predisposition to ovarian cancer, it's actually recommended to remove the ovaries preventatively. And lastly, your genetic test results can also have an impact on your chemotherapy treatment options, because there are certain classes of drugs that work better in people who have the hereditary type of breast cancer. So in summary, your genetic test results can impact your immediate breast surgery, future surgical decisions, and chemotherapy options. If you like this video, stay tuned for next week. We're going to be learning all about pre-implantation genetic testing, again, through a really cool TikTok video. Thanks for watching. See you next time. Bye.